Why is illegal organ trafficking a global problem today? Imagine waiting for a life-saving organ transplant, only to find that the waitlist is impossibly long. This is the reality for many people around the world. The demand for transplantable organs far exceeds the supply available through legal and ethical means. Since organ transplantation began in the mid-20th century, medical advancements have saved countless lives. However, the number of patients needing organs continues to grow faster than the available supply. In fact, legal organ transplants mean less than 10% of the total demand globally. This leaves thousands of patients waiting and, tragically, dying each year without treatment. This shortage creates a dangerous market for illegal organ trafficking. Criminal networks exploit vulnerable populations, especially poor and marginalized individuals in developing countries. They often procure organs such as kidneys and parts of livers from these individuals. These organs are then sold to wealthy recipients, frequently from developed nations, who are unwilling or unable to wait for legal transplants. The illegal organ trade is highly profitable, generating hundreds of millions to over $1 billion United States dollars annually. The trafficking process typically involves brokers who recruit donors through coercion, deception, or economic desperation. Local recruiters, medical professionals, and hospitals may also participate in these illicit operations. Because these activities often occur within legitimate medical settings, tracking and prosecuting these crimes becomes quite difficult. Victims may be hesitant to come forward due to fear, stigma, or potential legal repercussions. The hidden nature of illegal organ trafficking, combined with limited awareness and insufficient cooperation between medical and law enforcement sectors, complicates efforts to address the problem on a global scale. Unlike other forms of human trafficking, such as labor or sex trafficking, organ trafficking is less visible. It requires specialized medical knowledge and infrastructure, making it harder to detect. Historically, the milestones in organ transplantation highlight the remarkable progress made in medical science to save lives through ethical organ donation. However, the persistent global organ shortage has unfortunately led to a criminal market that undermines these advances and exploits human suffering. Practical efforts to combat illegal organ trafficking include raising awareness among healthcare providers, strengthening international cooperation, improving legal frameworks, and increasing ethical organ donation rates. These measures aim to protect vulnerable populations and preserve the integrity of transplantation medicine, honoring the foundational goals of this life-saving field.